Great. So yeah, thanks everyone for coming to our other frequently asked question webinar. We've been doing a couple of them. This might be the eighth one, I think. So thanks for joining. My name is Laura Santner. I'm a clinical social worker, and I've been doing this for quite a long time and working with BFRBs for quite a long time. So happy to be here and happy to answer your questions to the best of my ability. This is going to be pretty relaxed and casual. So, sit back, grab, some tea or something, some water, a fidget. Watching these webinars, you're just sitting there. So make sure you have a fidget. I have a fidget. I always start by showing you which one I have. So today, this is a pen. All right. You can have really cool, fun fidget pens. These are great for school, for work. Um, this is a fun one. Actually had a client give this one to me. There are just so many options. So highly recommend. So I'm going to go over the pre-submitted questions first, and then I will get right to your questions live. If something is unclear, or if something brings up another question, just write it in the Q&A box. Okay. We will go for about an hour, give or take. It depends on how many questions everyone has. Okay. So let's see. The first submitted question. I am wanting to inquire about NAC and what sense is in high doses for helping with pulling. So what dosage? I have seen up to 2,400 milligrams are safe and effective. Are there other behavioral methods that are working? So if you're considering taking NAC, NAC, by the way, stands for N-acetylcysteine. And it's an amino acid supplement. So if you are considering taking it, make sure you do consult with a doctor first. So far, NAC is the most promising supplement. It's the most researched. Um, um, but that said, there's still, of course, lots of questions. So dosaging is not quite clear. So I do recommend working with a doctor. Right now, the recommended starting dose is 1,200 milligrams. And yes, you're right. Studies have gone up to 2,400 milligrams. So when you're taking NAC, it is recommended to divide it. So if you're taking 1,200 milligrams, break it up to 600 milligrams twice a day, for example, especially around the times when you tend to have more urges. So maybe like in the morning and then like late afternoon or early evening or something like that. NAC may only stay in the system for about 8 to 10 hours. And for some people, it's out of the system, within 3 to 5 hours, according to some studies. So it has been suggested that higher dosaging could be effective, such as going up to 3,600 milligrams, but that's just been a suggestion as far as I know. And there have not been any studies yet that have gone up to that amount of 3,600 milligrams. So for now, I do recommend staying within that 1,200 to 2,400 milligram range. As far as your question is as far as other behavioral methods. So medication is not going to be the magic answer. So even with taking an amino acid supplement with NAC, it's still recommended to do other things, right? So other methods, other strategies. So you're doing it all at the same time. Doing just one thing is not going to be effective, but doing multiple things will be effective. So for example, doing some strategies like self-monitoring, right, to help you increase your awareness, practicing competing responses and stimulus control, mindfulness, breathing, acceptance and commitment therapy, cognitive diffusion strategies. These are just some. Um, some other additional methods you can do at the same time as taking your medication or without taking the NAC. So with or without NAC, I would recommend working on some of these strategies. Okay, let's see. What causes hair pulling? What kind of therapist do I see? So everyone wants to know this answer, right? What causes hair pulling? No one really knows. This is the big question. It comes up all the time. It's quite complex. I wish we had more answers, but basically, research does indicate that there is an inherited predisposition, um, which means it's a genetic predisposition. But just because you have that genetic predisposition doesn't mean you're going to get a BFRB. So other factors do contribute as well. So it's kind of like all of these factors happening at the same time. So other factors could include things like your hormones, hormone changes, especially during puberty, temperament, age of onset, any potential co-occurring disorders, environmental stressors, so things kind of like that. So it's this interaction between all of these things which wind up triggering the disorder. So the disorder could be like dormant, for example. It could be kind of in the body and never become activated. And maybe with the magic combination of these things, it unfortunately becomes activated. Um, oh, so the best kind of therapist. So you do want to work with someone who knows about BFRBs, is familiar, and ideally has been trained in BFRBs. So you can find someone who's trained um, there's a directory on Trichstop. I'm not sure how up to date that directory is, but it will be worked on soon. There's also a directory on bfrb.org. So that's another really great resource that has a list of therapists. When you're looking for a therapist, make sure they're familiar with a lot of different modalities, but specifically you want to look for some keywords. So that would include, excuse me, the COMB or comprehensive behavioral model, acceptance and commitment therapy, habit reversal training, cognitive behavioral therapy or CBT, dialectical behavioral therapy or DBT. So you want to kind of see if they hit any of those keywords. Other modalities are used as well. Again, it's a combination of modalities. So there is not just one thing that's going to be helpful. It's a little bit of everything. But those are just some of the things to look for when you're looking for a therapist. By the way, if you do decide to try the program out, all of the therapists in this program are all trained and all are highly knowledgeable. And what's great is because it reaches everyone anywhere all around the world. So it's quite accessible. So if you don't have a therapist in your local area, do consider something like this program. Okay, next question. Can you say something about the link with gluten sensitivity, intolerance, celiac disease? Hmm. So I have heard some things, um, but the connection between gluten sensitivity, intolerance, and celiac disease and trich has not yet been established. So it's not clear yet. There has been some research and there has been some studies, and some of those studies have suggested that there's a link, but it's just really not clear, and there does need to be more research on this topic. So I can't really give you a definitive answer for this. I don't think there is a definitive answer for this yet. So I hope there's more research soon. That's about all I know on this topic so far. Hopefully over time, more information will come about. I have seen some articles about this online. So again, I don't know how reliable those different articles that I saw were, but they exist. So keep researching and just know right now There is no definitive link that we know of. Okay. Another question, what are the links of dermatitis herpetiformis? I hope I'm pronouncing that correctly, to trich. So both dermatitis herpetiformis, or it's also called DH, and trich. So they're both chronic disorders, but they are different. So DH, that's a skin condition that's oops, oops, oh boy, sorry about my speaker fell. I'm gonna leave it. Um, so DH is a skin condition that's primarily caused by gluten intolerance. So that can manifest as this like itchy blisters on the skin. So trichotillomania, however, that's a mental health disorder, and that's characterized by compulsive hair pulling. So there's no direct link to dietary triggers or skin lesions. So trich and DH are quite different. So as of now, there's no known medical connection between the two. I mean, individuals can certainly have both, but they're not necessarily related or connected. Okay. What role does nutrition play in urges? So, Dr. Grant, he is a leading researcher in this field. So he did do some research on this topic, and he learned that sugar intake does play a significant role, specifically in compulsivity. So there's been no significance with saturated fat intake, according to his study. But the combination of high fats and high sugar diet did significantly was significantly associated with higher motor impulsivity. So, of course, more research is needed. But as of now, it looks like the combination of sugar and saturated fat can affect urges. But just a high fat diet alone does not affect urges. High sugar diet alone does affect urges. Hope that's clear. What is the connection between caffeine and urges? So Dr. Grant also did a study on this, and his results were quite interesting and maybe not what you've expected. So he showed that actually moderate daily caffeine use was associated with lower BFRB severity and urges. And moderate daily caffeine, that's about 1 to 3 cups a day. And he showed that that moderate amount offered some protective benefits to individuals with BFRBs. So it helped to increase alertness and without bringing additional negative effects that high caffeine use typically does. Such as affecting anxiety, irritability, restlessness. So high amounts of caffeine affect that, but the moderate amounts help people focus, helped to increase awareness. Um, and when you're more aware and focused on your behavior, it makes it a little bit easier to interrupt or to not start. Right. So that's quite interesting. Um, and as usual, more research is needed. More research is needed on everything, on any topic surrounding BFRBs. Okay. Let's see. Next question. Okay. What do I do about nighttime unconscious trich of BFRB? What are some strategies that have helped? Yeah. So it's hard to work on your awareness if you're sleeping. And pulling while you're asleep and while you're unconscious is actually quite common. So the best strategy in this kind of situation is to use barriers, and not just one barrier, multiple barriers, because when you're asleep, and unconscious, you very well might take off your barriers. um, so barriers help. It's just that like extra layer of protection. It blocks you from pulling. Um, it might even also wake you up if you can't quite pull. It might wind up disturbing you, and you might wind up waking up and become aware. Um, but other than that, it's a good method to block yourself. So some things that you can do to block yourself while you're asleep is to go to bed wearing a bandana or a light hat, light gloves, or something else on your fingers like band-aids on the tips of your fingers, even scotch tape on the tips of your fingers, although that might be a little bit more uncomfortable. So I think I would recommend gloves over band-aids and tape. Um, Again, depending on where you're pulling, long sleeves, long pants. You might also want to consider like a weighted blanket, because having that kind of weight and pressure on you might help to kind of um, comfort you and keep your arms down. So I do recommend again using a combination of these things. So not just one barrier, but multiple barriers. So for example, a hat and gloves, or maybe a hat and gloves and a weighted blanket. Um, so as many as you can is your best defense. I also suggest taking a look at what your nighttime routine is. So maybe there are some things that you can do before going to bed that will help you to get into a more relaxed and comfortable state. So take a look at what your night routine is. What's the temperature in your room? Are you comfortable? Are you hungry? Are you thirsty? Make sure you go to the bathroom, or maybe you take a bath or a shower in the evening. Maybe you do some body scans. Maybe you do some reading. Maybe you do some journaling. So think about what what you can do at night to help you transition kind of softly and slowly into sleep. Um, Music, be mindful of what the lighting is. So take another look at that. So what you can do before going to bed can affect what happens while you're asleep, and then barriers. So that would be my suggestion and some things to try. Okay. Um, Boy, I think we just have yeah, one more pre-submitted question. We're going through these pretty quickly tonight. So as questions are arising, please feel free to write it in the Q&A chat, because I will get to that. Is hair pulling associated to a specific personality type? So this has been a more recent question that's been arising. So much so that we did do a webinar on it. So check out that webinar. I think it's really helpful. In addition to the webinar on Trichstop, there are also maybe one or two blog postings or articles on this topic. So check that out as well on Trichstop. So what I have to, I guess, add to that or summarize that is that there is no personality type. There's no specific personality type that we're aware of that's related to trick or associated with hair pulling. But people with hair pulling do show certain personality traits. So some personality traits do seem to play a significant role in pulling and how a person might cope. So for example, let's see, I have this over here. So for example, neuroticism might have a strong influence. So what that means is that someone may have a personality type that is more sensitive and more nervous instead of being resilient and confident. Being more introverted has also been linked with hair pulling. So that means that you might focus more on your own thoughts and your own feelings. You might avoid more socialization. So research has found that introversion was linked to increased severity of pulling, worsening of moods, higher perceived stress. Another personality type, which was quite interesting, is conscientiousness. So this personality type has both positive and negative sides to it. So on one hand, um, having high conscientiousness, that can help develop structured routines, help you to have more effective coping. But on the other hand, it could also lead to excessive focusing on perfectionism. And as we know, that can also increase urges and pulling. A lack of consciousness can be associated with more depressive features and depressive symptoms and more impulsivity and higher stress levels, all of which can affect your urges. A person might struggle with impulsivity. Um, so that person might find it more difficult to resist urges, and that immediate tactile sensation and sense of relief is more likely to reinforce the pulling, reinforce that behavior. So basically, um, different personality traits can play a role, but there is no definitive personality type that's associated with hair pulling or BFRBs. Okay. So hope that answers some of those questions. Again, if you need more clarification, just write in the Q&A and I'll see what I can do. Um, oh, we got this this question. This should be the first thing I go over every time because this has been coming up recently. What is a BFRB? Of course. So a BFRB is a body focused repetitive behavior. So hair pulling is BFRB. Other things that are BFRB are things like skin picking and nail biting. There are others, but those are the popular ones, I guess. So hair pulling is a BFRB, a body focused repetitive behavior. Okay. Yeah, so I'm starting to get gray hairs in the area I am pulling most. I'm only 24. Is this normal? Will my hair grow back normal? Yes, it's totally normal. Um, what happens is when hair grows back, the color could be different, the texture could be different, the thickness can be different because it's kind of been stunned a little bit. I kind of describe it like that. So it takes a little bit of time for it to kind of to catch up with itself. So just because it's growing back in gray doesn't mean it's going to stay gray. It just might take a little bit of time to kind of get back to its color. So hang in there. It's normal. Okay. My almost 3-year-old has pulled for over a year now. She does it for comfort in conjunction with sucking her thumb. Excuse me. She's old enough now that she thinks it's funny when I tell her gentle hands and hasn't stopped. Looking for any guidance to help this stop. Yeah, so it can happen. It can happen early. It can happen at 3 years old. I would still consider this young, so I would consider this baby trick. And what that means is that she's most likely going to grow out of it because she's still trying to figure out herself and her feelings and how to cope and manage and express. So you're right. Right now, along with sucking her thumb, um, it's a comfort thing. So some suggestions. I like your gentle hands, gentle hands. I like that suggestion. Do not tell her to stop. That will not be helpful. But gentle hands, maybe you want to massage her hands. Um, she might find it fun if you find, a paraben organic lotion to do a little paraben free and organic lotion to do a little massaging, hand massaging, be gentle. So show her that gentleness. Um, and start conversations. Help her to learn how to express. So if it's for comfort, ask her, what is making you uncomfortable right now, and give other suggestions. Do you want to hug? Right? Do you want to go on a walk? Do you want to draw? Let's draw together. Let's play some music together. Let's listen to music. So start thinking about strategies, but being a role model and do them with her. So she sees that there are other options. So those would be some of my strategies I would suggest to start off with. Um, so don't be too worried about it, but be a role model and help show her other ways of coping, um, and other ways of self-soothing. Okay. So give it a try. Let us know how it goes. You can always email us as well, at support@trichstop.com. Ah, hello, I'm a clinician and I was wondering if you offered formalized training in trichotillomania. So I have brought this up. So it is something that we've been thinking about, as the organization, because we have so many clinicians that are highly trained, and so we are quite knowledgeable. But as of now, we do not offer formalized training. There are other organizations that do offer training and other individuals. So training is out there, but currently Trichstop does not provide training. Maybe that will change in the future. I don't know. Oh, where can I go to find good but reasonably priced fidgets that look normal and not like a fidget? No one really knows that I have trick, so I would like it to be discreet. Yeah, so there are lots of discreet fidgets. If you check out, I did do a webinar on fidgets, so check that out. You can look on the website at Trickstop, or you can also look at the YouTube channel and fast forward it to the section. I do have a section on discrete fidgets. Um, there are plenty. So besides fidget pen, you might not want a fidget pen like this, although maybe you do because it's kind of fun. But different kinds of pens that have grips on them could be really good if you're out in public. My favorite is different kinds of fidget jewelry. So things like spinner rings or different necklaces, magnetic jewelry. I was talking about um, worry stones. Those are really nice and discreet. And things like massage rings. Those are really small. Who doesn't want a massage ring on their desk? It feels nice. Other things, like basic office supplies actually can be really good fidgets, like rubber bands and paper clips. I really like paper clips because I like, you can kind of stick your finger in there and it kind of puts a little pressure and it feels kind of fun and it's fun to play with. Even things like fidgeting with nail clippers, kind of twisting it around and making it into nail clippers, turning it back to not nail clippers, taking out the nail file and just spinning it around. So plenty of everyday household items that can be fidgets and can be subtle. So try some of those and see what works for you and see what you're comfortable with. I found myself starting to scratch my scalp and create sores. How do I stop this? Yeah, so that's also under the umbrella of BFRB, body focused repetitive behavior. So you would use strategies the same as other BFRB strategies. So paying attention. So first, for example, doing some self-monitoring just to learn a little bit more about what your patterns are. What's going on? What are your thoughts? What are your feelings? What are the situations? So when you have a better understanding of what's going on, so pay attention to the acronym SCAMP. So sensory, cognitive, affect, motor, and place. So thinking about potential triggers, sensory triggers, cognitive triggers, affective triggers, motor triggers, and place triggers. So when you've kind of figured out that, you can think of different strategies that go in each of those categories. So sensory triggers, um, meaning like fidgets to help other with other sensations. Cognitive strategies, meaning what are your thoughts and how can you manage your thoughts, rephrasing your thoughts. Affective strategies, if you're feeling anxious or bored, how could you cope and manage that? Motor strategies are what are your movements? Can you block yourself? Can you use barriers? And place strategies. Where are you? What is the situation? Can you make any changes to where you are? So for example, if you're scratching and looking in the mirror, can you cover the mirror? Can you keep the lights dim? Can you put post-it notes as reminders? So things like that. How can you work on your environment? So lots and lots of different strategies and combination of strategies. So you just have to kind of experiment and see what strategy makes the most sense for you and what feels right, and what combination works best for you. Okay. I hope that helps to kind of get you started on a path to working on it. My 16-year-old has been pulling her eyelashes for over 2 years now. We have tried some strategies without much success, but at a loss as to what to do next, and we live in Australia. You know, interesting enough, Trichstop has a lot of people from Australia. Um, so I wonder if that's because the support in Australia, I mean, you tell me, maybe there's just not a lot of experts in the area over there. Um, but we do have quite a lot of people from Australia who are in the program. So joining the program is an option. Your 16-year-old can join the main program. If your 16-year-old does not want to, which is fine. I mean, as a parent, you can also consider joining the program. And then you would be learning and sharing whatever information you'd like to share with your child. Um, and it's tough. So I would suggest, I mean, keep trying the strategies, even if the strategies you're using you're not really having a lot of success. They still might be helping, because it's hard to really define success. So every little bit helps. So keep using the strategies, keep experimenting with strategies, keep experimenting with which strategies to use in what situation. Again, be mindful of this idea of SCAMP. So different strategies within each of those categories. So sensory, cognitive, affect, motor, and place. So I would suggest trying some of that. I can't speak to more details because I don't exactly know what you've tried already and what the situation is and what's working and what's not working. Um, but that's something to consider. Um, my other question to think about is, how much is it impacting your 16-year-old, and do they want to be working on it right now? Is it bothering them, and are they ready? So readiness does play a significant role in what's going to be effective and what's not going to be effective. Um, so give them the space that they need, ask them what you can do to help. And it's a tough age because, they might want you to help, but they might not want you to help too much. Right, because they don't want, sometimes it can feel like annoying or overwhelming. Um, and it's upsetting for them, just as it's upsetting for you to see. I do actually also recommend, there is a webinar for parents that we did. So check that out as well and see if that webinar has some additional um, strategies, suggestions, guidance, and next steps. So those are just some ideas that I suggest to explore. Is this going to be a lifelong journey of trick, or will I be able to stop completely? Yeah, so everyone wants to know this question as well. So, trick is a chronic disorder. So, what chronic means is that it is lifelong, unfortunately. Um, but that doesn't mean it's going to be active forever, and active lifelong. So I like to think about it as it's going to always be a part of you, but it could be deactivated, and it could be deactivated for a very, very long time. It could be deactivated forever, but it might be something that you'll kind of maintain an awareness of forever, but you might not have urges forever, and you might not pull forever. So, uh, so if that makes sense, it's basically, yes, it's a lifelong journey, but it doesn't mean that you're going to be struggling your entire life with it. Yeah. So there is hope. Hang in there. And as time goes on, we'll have more and more answers as well, hopefully. More and more people are coming out with having trick and with having a BFRB. The more people that come out, the more researchers will see that it's significant, and more than just 2 to 3% of the population have it. It's most likely even more than that. So the more people that suffer, the more likely researchers will get funding and will get more answers. So fingers crossed, we're getting there. Okay. Okay. Actually, I've completed the questions. So feel free to ask more. I'm here if anything else is kind of arising. If nothing else is coming up for you right now, feel free to email us at support@trichstop.com. We can always answer questions later if something's coming up. Um, we do these frequently asked question webinars frequently, maybe about every other month. So if something comes up within the next month or two, come join the next one. Come join the next one, ask your question, email us. And oh, thank you. Yes, thank you. This was great. Good. Yeah, I'm so glad that this was helpful. Yeah, we like to do these pretty regularly just to have this space and opportunity to ask questions, whatever they may be. Yeah. Oh, I feel seen. Thank you so much. Yes, I do see you. Yeah, I'm here for you. I'm personally here for you. Trickstop is here for you. Everyone on this call, we're all here for each other, right? This is, it takes a team. Yeah. I do recommend at some point in your journey, if you have not talked to or met anyone else with the BFRB, I do recommend joining a support group or considering that, because it can be really nice to be around other people who also have BFRBs. And it helps to feel seen. It helps to feel understood. It helps to feel less isolated and not alone. So support groups can be, can be difficult to join. Um, but I do, difficult meaning kind of emotional. You might feel a little bit strange, but I do recommend checking one out. Where can I join a support group? So, there are so many options right now. So there are support groups through this program. I believe you have to be a part of the program to be in the program support group. But that's a question to double check with support@trichstop.com. But besides that, there are so many. BFRB.org does regular support groups. BFRB Changemakers does regular support groups. BFRB UK and Ireland does regular support groups. These are all different virtual support groups. You can go on BFRB.org and look under support groups, and you can search in your area or see if there are any in your area. And if not, there are others virtually all around. So there are options. Yeah. So check that out. Okay. Other questions or comments for this webinar? Oh, okay. Well, I thank you all so very much for coming and joining with me. And I'll see you next time. If something else, well, I won't see you, but I'll read your questions next time if something comes up. Okay. So take good care, everyone. I'm going to stop the recording and then I will end our session for today.